BW Healthcare World, Dr. Tarang. Thank you so much for joining us today. My first question to you is that you've been in the healthcare domain for a while now, and we've seen the healthcare domain go through a sea change in the last 2 decades, and more so in the last 3 or 4 years because of the pandemic that we have seen. What are such changes that you have observed in the last 2 decades that you have been a part of healthcare industry?
So first of all, thank you for having me over. It's a privilege. Yes, healthcare all over the world actually has gone through a vast sea change, and we've seen various peaks and troughs. And of course, last couple of years have been very different. So what did we see in the last 2 decades? We have seen that there is a lot of evolution in healthcare. Uh, Across the globe, we've started taking health as something which is very serious and very important for any economy to function well. You can only be as healthy as your healthy part of your workforce. So, and healthcare is that's why most important. Um, while we have also seen the changes in the new technologies, the new research, and new drugs and molecules coming, people taking over cancer head on, getting into stem cell research to combat the future ailments. But I think the way the healthcare has changed his outlook from focusing on only acute care to the entire continuum of well-being is something which is important. More so has happened last 10 years, I would say, that has been the focus across the globe, whereby we are now, people are focusing more and more on how to create healthy population at a healthcare overall headquarter, from a headquarter or a helicopter view, that we have to create healthy population. Creating healthy population doesn't actually mean treating the sick. So there is a difference. So I think people have slowly started realizing across the various economies that healthcare is a piece where we need to now put in more efforts on creating health and well-being of the society rather than just treating the sick and focusing all the resources on finding out new solutions. So 2 decades back, the focus was finding breakthroughs, which continues. But in last 1 decade, the focus has been on focusing on healthcare as a piece where we want to keep the population in general a good state of well-being. So that's a fundamental change which has come. What did last 3 years make us to realize was we may be as advanced as we may think, but still there is lot of darkness when it comes to healthcare facing something which is unknown, which has shaken up every economy of the world in last 4 years. Nobody anticipated that there will be a day when you will not go out of your house to workplace. And but we saw that day. We saw those days. We went through that. We saw people around us falling sick, some dying, some coming back. So I think we also, while everybody realized all the more so that health is very important, they also realized the importance of healthcare professionals. So in that essence, what has world seen a change in last couple of years is that yes, healthcare is something which can be harnessed more through a good digital platform, because there was a time that during COVID, the well-being part or the regular issue part was left to digital world. Like people, doctors, senior doctors who said, we will never open the computer and see a patient, were consulting patients from morning till late night on the computer. They, over a period of 1 week, learned how to use the computer, which they said in our own lifetime, we will never do it. Is this a way of practicing medicine? Was some of the statements which I used to hear from some stalwarts who then moved on to that. So basically, we harness digitization to extend our reach, to scale our reach, which could not have been so fast. At least it could not have been that an eye-opener, all what we saw in COVID. Then I think COVID also realized that through digitization, you can reach to the interiors of the population. Now, every country of the world took it in a very different way. In America, most of the offices have now shut down. People are actually closing down their clinics and all because they said, what I need is actually a computer, which I can do it in my home. Why should I rent such a big infrastructure and do it? I just need a space to go and do my procedure, come back, I'll do all my OPs. They are moving towards that. India, unfortunately, is again retracting back into the shell because people again want to see patients one on one. However, having said so, I think we have a fair amount of opening whereby we can take this quality healthcare in a scalable manner through digital world to tier 2, tier 3 cities or even more interiors where there is so much of shortage of doctors. We are lacking almost 3,000 doctors in the primary medical centers of our country. We have and that acute shortage is just increasing day by day. Also, I think India as a country has to focus on this piece of well being because we are a young workforce. Our country's economy develops hugely on the workforce, the younger workforce. So, their well being is of key importance for the growth of the economy in general. It is not only important for the people not to be sick, but if we want a healthy workforce, we want, and India is on the move. Everybody in the whole world says, oh, India is on the go. So for us to be on the go and for us to run, we need a healthy workforce. Unfortunately for India, today also we have almost 27% of healthcare only in metropolitan cities, and almost 75% of resources are parked in only this 27% of the people that they cater. Majority of our population, which stays in the rural area, still is devoid of the healthcare. Forget about well-being. We are talking here on acute care. Also is devoid of. So I think harnessing the technology, creating better models of operations by what COVID taught us, I think we should not forget that so soon. So we should move ahead with public-private partnerships to make our reach go to the last corner of the country. And to also, I think one more important thing is that during COVID, all doctors, all nurses were so celebrated. We still remember, I think every doctor remembers the day when one day everybody decided to go in their balcony, clap for the doctors, clap for the nurses, clap for the healthcare workforce. I think we need motivation, and the motivation has to come from top for the healthcare workforce. It's the same workforce which worked in COVID, which burnt in COVID. We are still working that hard only, but I guess we need to have more of that regularly, and also we need to motivate our doctors. Otherwise we will be also facing the problem which West is facing, where almost close to almost 300,000 doctors are actually thinking of quitting healthcare post COVID. And that will put one of the best healthcare system, which we depend on and call it the American healthcare system, into a big jeopardy. So if I see as a leader, I personally feel if India can go to the extent of using the digital technology, the brains, the the resources that we have, we can actually take care of the US population also.
Got it. Got it.
Because their people are burnt out.
Right.
We have to prevent our workforce, healthcare workforce, from burning out by regularly motivating them. And this is basically the change that we have seen so far. Going forwards, it's up to us what we see. Now, whether we harness that or we let go of that opportunity and let countries like Singapore and Thailand benefit from it.
Got it. Now, I think you beautifully brought out that, a couple of things that we have seen change is the integration of, mental well-being along with healthcare, so that it goes beyond the sick care and it is, a little more holistic, as well as the focus on technology, which has existed for over a decade, but has now come to be adopted both by the practitioners as well as the seekers. So that's a big change. You also mentioned about the public-private partnership, and you work with the government in Singapore, apart from working with private institutions there as well as in India. How do you think that public-private partnership can help solve the problem for tier two and tier three, along with the technology that now exists?
So I personally feel, see, in Singapore, the healthcare system is just beautiful. I can just say that I'm always in awe of that, and I'm very fortunate. I worked in their healthcare system for 15 years. I think it's a best example of public-private partnership as can be. So most of the best hospitals of Singapore are actually private limited, but they are called those restructured hospitals, which were once upon a time, even like National University Hospital System or Singapore General Hospital, these are all actually private limited. But they are the way they run is they treat everybody. Means they have economy to the top line coming, like the single rooms and the suites and everything.
Got it.
But the operations run with efficiency of a private healthcare system. So they got the best of both worlds there. Something along the lines with which today I would say, like in Mumbai, we have these charitable trust hospitals running, which are actually supposed to be not for profit, but have to sustain themselves. So they have to make some profit to reinvest in themselves. And at the same time, they have to have their controls are very efficient and privatized so that we bring the efficiency out of the system. So that is a beautiful example of a healthcare model. And the way they have done the zoning, of course, it's possible because it's a very small country. So you have a northern cluster, you have a western cluster, you have an eastern cluster, and you have a northern cluster. So everything is in that ecosystem, including nursing home. No patient has to go from the north to the east or the west. You are all contained. It's easy for a country like Singapore to do it because it's very small. But I think something along those lines can be done at a state level, at least, to build up those models where everything comes and becomes a part of the same cluster, and the patients don't have to wander around to get healthcare. Healthcare has to be provided and has to be accessible to the patient. The patient should not go and look for healthcare because that's the whole essence of patient centricity. As far as we are concerned here, I think that is something which we need to do, whereby we can harness the public private partnership in a way, take our not only in the management and bringing efficiency and accessibility of the healthcare, but to some extent, we have to make healthcare equitable also. In the sense that today, if I have the resources to fly a business class or a first class, then just because I'm traveling in economy class, I should not be made to sit on the floor. I'm still made to sit on the seat. I still get the food. I still get the service. I still reach to my destination. Likewise, in healthcare, it has to be equitable in the healthcare which is given. You may definitely play around the hospitality part of it based on the class of the patient, but the general quality of care, the clinical care, the patient safety has to be equitable. And that can definitely be achieved very easily with a public private partnership for managing an organization. Also, where all I know that this government particularly is trying their best to reach to the outreach. They have created such, as a part of the national digital mission, they are trying to reach to everybody. They are trying to enroll everybody through the ABHA ID program and all. But I guess if such a motivated government joins the private care, especially of the people who want to make difference, then it can actually use the technology to reach to them. Once the technology reaches to the last bit, whereby we can give even services like tele ICU, tele radiology, even pathology reports can be digitally seen and the reports can be given. The pathologist does not have to go to the rural city to see the slides. Today, with the digital, you can actually sit in Mumbai, see the slide and give a report of somebody in Srinagar, small rural town, and tell that whether you have cancer or not. If you have cancer, come to the city quickly. So I personally feel that we need to harness this. Once we have that database created, then only we can make it further robust with the artificial intelligence, because then you don't even need so many doctors to see, because then through AI, the everywhere, the most of the 98% of diagnosis which will already be given to the patient, and the reach would increase. And of course, I guess for consultation, for second opinions, whereby people travel from one part of the country to the other part, those things definitely we have to go on a technology basis. And I think everybody has done it in COVID. So there is no reason why we should not now do it. So I guess these are some of the things whereby the government should tap the private resource to increase the accessibility and equity in the healthcare, and provide a quality care and with which is safe healthcare to the people, because these are our key pillars. And private players will definitely bring more or strengthen the efficiency of the model of care for sure.
Yeah, I think it's a very beautiful point that you brought out, because the minimum standards to be maintained along with the public private partnership could do actually a lot of wonders to bring equitable healthcare to everyone. Dr. Tarang, again, I'm mentioning that you worked in Singapore and both in the private as well as the government, and you also worked in India for a while now. And where do you think that Sir HN Reliance Foundation Hospital stands among various other players in the same segment? And what is it that you are doing to make this institution stand apart from everywhere else?
So I think this is a hospital of future, and I always say that this is a hospital of future because it what we are trying to create here is ecosystem which takes care of a patient from end to end. So from the time he's healthy, then when he becomes sick, then he's recovering, and then finally again when he's healthy, and we go a step ahead to ensure that they continue to stay healthy. So the focus is on the whole continuum of well-being, and it is not only focused on the mental well-being but the physical well-being. So we try to put a lot of emphasis on our preventive healthcare program, whereby we run several health checkup packages. Some of them are even run on home care basis. I think this is something which makes life easy for people who are busy working, traveling. So we just try to do it as quick as possible and offer them the service, that because we want generally the populations to be healthy. Coming to the acute care side, we work very hard to get the best of the technology, best of the clinical skill set to develop a good quality healthcare to the masses. And one thing that we focus a lot is on the clinical outcomes, because, and that is something which is led uh, from my side, means I don't rely on anybody downline to lead that, because for me, clinical outcomes is something which is most important, most pertinent, because that is where the whole expectation of healthcare lies. There is no point for any hospital today to keep the patients unnecessary in the hospital. A, it's harmful for the patient because they'll get infections. And secondly, I'm sure most of the best healthcare leaders know it, but the fact is that you don't earn if you keep the patient longer. You earn less. So even business wise, it makes no sense. So either ways, but we have a habit of prolonging stays. It does happen. So where do we act is we act at that areas which can prolong a stay. So we have to avoid infections. We have to ensure that post-op complications are not there. We have to ensure that the patient's length of stay is within control. That helps us to serve people, send them back to the community faster, build their trust, serve more patients because you have more bed availabilities. And then once they are recovering, also, we have a very robust home healthcare model, which is linked with the acute health. So even when you're gone, we don't leave you. If you have a wound, we can come and dress it up for you. If you need physiotherapy, we can come and do that for you. If you need some blood test for the next 15 days, we'll come and do it for you. And finally, we again put you on a health checkup so that you don't fall sick. So I think that's the way we may try to make difference in a way so that we excel not only in terms of technology and clinical excellence at the treatment level, but at the preventive and the recovery phase also, because I think that's important. Second thing is, I think one of the most important thing which I have learned in this hospital and which I have always found is one of the thing is where is something which the chairperson of our hospital and the entire group and Mr. Anant Ambani, who leads the healthcare initiatives from the forefront, believes is that we do not just treat health, we respect life. And we respect life of everybody, whether it is the life of a patient, whether it is a life of our staff, whether it's life of our doctors or anybody. So we were one of the hospitals which I proudly say I did not lose one manpower in COVID throughout last 2 years. Not a single of our person we lost to COVID. I have my whole healthcare workforce as it is what it was before and now. So I guess this is very important. We have to focus on our people. We have to focus on because through them we focus on our patients. And last but not the least, we have always been told as a mantra that we have to treat everybody with a seva bhav. And patient comes here not only for treatment but for an experience also. So day in and day night, we try to work out to give them not only care, compassion, but an experience that they feel that yes, this is the hospital where I want to go. And over the next few years, I'm sure we will see more of such healthcare systems coming across over the city of Mumbai and beyond.
Respect life is a very powerful statement and intent with which the hospital is being run. So that's a very beautiful aspect. And you brought about the point of not having lost a single staff member during COVID, etc. Now, hospital staff works in an environment that is usually surrounded by sadness, pain, because that's what they're seeing at the epicenter in their workplace. How do you ensure a strong mental health to your professionals, both medical and non-medicals, men and women? Are there some initiatives that you have taken uh, to take care of that inclusivity as well as employee well-being?
So I think one of the things is that I personally feel, and I'll be very candid here, we have taken some initiatives, but I think we have a very long way to go, very, very long way to go. And why I said say so is that uh, we have the initiatives. We have a very strong HR team which connects with the people. We have our leadership teams which connect with the people till the ground level. Uh, I am completely accessible to every staff of the hospital. So anybody can come to my room, can write me a mail, send me a message. It's all over. So accessibility to people is important, but most important is a security to them that if you have a problem, we care and we are there. And one of the most important security that we give to our people is that we take care of their health and their families' health. And that is a practice which we carry from our parent company right down. So during COVID, every staff's health was covered. Not only staff, their families also were taken care of. And not a single person was said no. Post COVID, also, if there is any patient, any staff member who's not well or whose family is not well, I think we go an extra mile to ensure that they are very well taken care of. And the most important thing is that, see, every hospital has certain initiatives. We have initiatives where we have motivation rounds, we have the rewards and recognition, we have ours set up like we celebrate certain days for the nurses, for the technicians, for the pharmacists. That is very uniform. But the fact that they have the accessibility to everybody in the system is something very, very important. As far as the mental well-being is concerned, there are ways and mechanisms in the system. So we have psychological counselors, a huge, big workforce of psychological counselors in the hospital, accessible for the staff and the patients. Patients redirect, staff can just go and they can just talk to them, they are counseled. All that database is kept very, very confidential. It's only shared with certain people, and that too, if it's a matter of concern and it will affect the performance of the person on the job, because that also is very important, because for us, the safety of the patient is also very close to our heart. But that doesn't mean that if there is such an issue, you will the person has the security that you are not going to lose your job or anything. It's just that we may move the nature of your job so that the safety of patient is also taken care of, and at the same time we give you also time and comfort to come out of a grief or something that you face in your family. Everybody has issues in life, and I think a, a as an employer or as an organization where we spend almost 10 to 12 hours of our life daily, I think this is a bigger home than what we have at our home. So obviously it has to have a bigger sounding board than our home has. So we just try to balance it out. And I think we are trying to move towards from a culture where I personally relate and tell to my team that going to a counselor is not something that you should shy away from. It's like going to a physician when you have cold and cough, or going to a gastroenterologist if your tummy is not happy with you. So likewise, if you are not feeling happy about yourself, go to a counselor, talk to a counselor. Nothing is going. Nobody is saying that it's just a state of mind. The way my state of body is there, same way if my state of mind is not right, I need to go and talk to people. And then if I need help, we are here to help. And we are here because we care.
Awesome. Since you brought out the word balance, let me ask you, you are a doctor and you're also now a business leader, right? And you've been working in the healthcare industry for over 2 decades. How has life for women healthcare professionals changed over the period of time?
Well, it's an interesting question. Um, I had never felt it, but I started realizing it as and when I started growing in my workplace as a clinician, as an orthopedic surgeon, and as an administrator. I think there are challenges for women leaders, and the challenges are the way we feel that the challenges are in India. I personally feel the challenges are global. Only thing is that it's not that obvious, but the challenge is there. So it can be any country, but you will always see that the women workforce at leadership level is very less. And in healthcare, it's hardly there. Like you will have to really go with a telescope and find out which are the healthcare leaders who are women. So there are challenges, but things are getting better, I would say. And I think I've been very fortunate that I've always worked and I've always been supported by the women leaders who are role models by themselves. So I think uh, I always tell myself that if I can take care of, or I can actually bring up certain women leaders and create new leadership levels for healthcare, I think that is something which will be a very big contribution from my side to the women healthcare leaders. And I really try my best to do that. But I have always been fortunate, as I say, and we are very fortunate in Reliance that we have Mrs. Ambani, we have Miss Isha, who really rule, who are really like the role models, and they really believe in women empowerment, and the empowerment is actually there. Like many times we are very apprehensive that whether there is a real empowerment or we are just using the word empowerment, but actually there is a real empowerment in the group itself, and that's why there are so many women leaders in the group also. But in healthcare, I think there are challenges, but I think it's how you manage yourself, how you drive the outcomes. And of course, if you are fortunate to have people who are not gender biased, then I think there is a long way to go. But still, I think in this state, I think India should lead the way. A country where the president is a woman itself, I think India has to lead the way, because, as I said, it's not that the West has got less of ceiling effect on women leaders. It is all the same. Only thing is, it's not that obvious. But I think we should lead the way, and I'm sure we will lead the way we are progressing. But healthcare needs to have more women leaders, not because I personally feel that it's the balance. So in our leadership team also, we have 60% women and 40% men. And that ratio keeps on changing. I try to ensure that it's never, it is always 50-50. It's not like too low for any or too high for any, because that balance is very important. Everybody brings their own worth on table. And as a hospital, we have 67% women workforce of the whole hospital. So I guess this is one of the hospitals which is really where we really support women empowerment to the last bit of it. But I personally feel that we need to have more broader ideas in healthcare, and we need to give a ear to women leaders in healthcare because of the experience. And also, as women, I think we have seen the healthcare very closely from the time we give birth to a child to the time we grow old and take care, and we are being taken care of. So I think we see the healthcare very closely, and hence I think that compassion and empathy comes very naturally, and that is something which the healthcare of any country, any state, any city needs at any time.
Dr. Tarang, we have moved as a country, as India. We were at a point when if somebody became unwell, somebody was diagnosed with cancer, the first thing would be, let's find a doctor, let's find a connect in the Western world, let's find an access to a doctor, somebody who can see the reports, I can access to. Now that has changed. Today we have world-class hospitals in India. We have the best of equipment. We have a great environment. Now, with the Heal by India initiatives, do you think India can become a key healthcare player to the world?
100%. As I said earlier, now is the time for India to harness that. Because, as I said, in the West, we are witnessing a lot of burnout of the doctors. If the doctors are not there, the brains are not there, how will the technology also work? So it is the time for India to actually harness that whole thing and leave the world, because you just have to provide a quality and safe healthcare on a scalable basis, either through technology, by giving them second opinions from here. Because if you see any country where healthcare is supposed to be strong, you will see an Indian sitting somewhere at the top positions in terms of the brains, whether it is oncology, whether it is gastroenterology, whether it is urology. I always see an Indian sitting whenever I'm looking for somebody in US or in England for the best of the healthcare ecosystem. So why not make our country's doctors empowered, strong, increase their reach to the world? So they can do teleconsults, they can reach out to the people. And at the same time, we create quality infrastructures here. We create patient safe infrastructure here with less waiting time. and get those patients to come to our country and take care of them and provide them the best of the healthcare, because the demand of healthcare globally is just going to rise, and the supply is just going to decline. So we need to, this is the time for India. If we don't do it, some Southeast Asian country will do it.
Got it. Got it.
The benefit we have is of the cost, because every society is cost conscious, and India has got, if not cheapest, but very value for money healthcare system, even in the best of the private sector. The only thing that we need to build as private sector is the trust of the patient, because people abroad look at the trust in the healthcare system when they plan to come here for any treatment. And most of the time, if that trust is broken, then they move towards other countries. But I personally feel this is the time for India. We can actually, over the next 10 years, build up a state where we can actually lead the healthcare from the front, digitally, technologically, and in clinical excellence.
Got it. Got it. And when it comes to technology, what is that one thing that you wish for technology to do to make hospitals more efficient?
If it was the hospital efficiency, I personally feel there are actually two things. One is that every hospital has to have a very robust medical record system, which is not people dependent, to turn any clinical pathway or identify any adverse outcome which has happened. It has to be a completely technology driven platform. Second area which I personally feel which can bring efficiency is that we have to have a technology platform where healthcare services is available like it is available in retail. So like we have a GeoMart, like we have a Reliance Retail, like we have Amazon. The healthcare has to come on such a technology platform whereby you give the users a choice. Okay, these are the doctors, and not only the choice of selecting, but the ease of business, whereby you know that it can quickly, we can just quickly do the whole transaction, come out of it, and we got what we wanted, and a holistic approach. So I guess these two areas, apart from that, I guess robots, this, that, that is fine. That is your technology for your clinical excellence, which based on the hospital, every hospital can do it. But most important is that every hospital's electronic medical record system should be unanimous and integrated. That is most important. So that even if the patient goes from Chennai to Mumbai, if our healthcare record system are talking, we know everything about the patient before the patient reaches to us. Today, bichara patient has to carry one papers, documents, sometimes they get spoiled, sometimes some paper is not given. I think that is something which is most important if we want the healthcare to go to the next level.
I completely agree with you. In fact, I keep telling everyone that, in case of an accident, when a patient is taken to the hospital should know everything about that patient by default. So that's
Correct.
where we need to arrive at.
Right.
Dr. Tarang, my last question to you before I let you go is, everyone needs some inspiration, right? To keep going and to make contributions. Which Indian healthcare business leader do you look up to and derive your inspiration from?
Well, so I can just say that I look up to an Indian leader who I derive the inspiration from to do everything perfect and with complete compassion and empathy, and that's our chairperson. And it's not today because I work for her. It's since the time I was in Singapore and I went to the business school where I actually came to know about her and the good work that she's doing in various areas, not only in healthcare. I think we are blessed, and I think God has given her the powers that whichever area she touches upon, because of her perfection and the way she takes care of things, that becomes gold. And I always keep that in my heart. And I always see that how perfection, she defines the new limits of perfection, whichever thing she does. And once we work with her, we realize that I used to always think my biggest weakness was at one point of time was that I'm a perfectionist, too much of a perfectionist. But when I work closely with her, I realized that no, this is perfection. I'm actually learning in the phase of perfection. So I guess it's the detailing, the perfection, and it's that you do everything as if you have to do it with the full compassion and give your 100% is something which I get an inspiration from. And in the Indian healthcare side, I personally feel that we need to have more inspiring healthcare women leaders who lead the way in a holistic manner. And we are really looking forward to such stalwarts. Of course, I will be incomplete if I say that I have never read about the good work that Ms. Sangeeta, Ms. Sunita Reddy, and Ms. Pritha Reddy have done in the healthcare field, and the approach that they have taken. But if you were to ask me who is my inspiration, then it is, of course, my chairperson. And I'm very fortunate because I had actually once thought in Singapore while I was doing my business school, and I was learning more about the way Mrs. Ambani has developed the whole ecosystem. And I had wished that once maybe I should get a chance to work with a leader like her. And when I started working here, I felt that wow. I mean, there are times when whatever you ask sincerely from universe, it makes it happen. So I guess I learn a lot from her. We all drive so much of energy from her, and so it's just fantastic.
Lovely. Dr. Tarang Gianchandani, thank you so much for taking our time to speak with us and sharing your thoughts and opinions about the healthcare industry and where it needs to be. And I wish you the best. And I wish that you continue to do the great job that you are doing at the Reliance Foundation Hospital. Thank you so much for taking our time.
Thank you so much. Thanks a lot. Bye.